Welcome to Pregnant Possibilities. And my partner is Dr. Deborah Shapiro. She is a board-certified OBGYN, and together we created a program called the Pregnancy Advantage. And our objective is to help women to get their bodies pregnant ready and to provide support if you're experiencing difficulties in conceiving. And today on our show, we are going to be discussing what happens after birth. And, basically to you, the changes that your body's going to undergo. And we have Dr. Jill Zechowy, who is a family physician with a master's degree in counseling, psychology, and a concentration in marriage and family therapy. And she has a practice at Women's Mental Health, MD, in Santa Rosa, California. Her practice specializes in perinatal mental health. And she's currently writing the book on it, on preventing postpartum depression. So you can find her at womensmentalhealthmd.com. Thank you so much, Jill, for taking the time to connect with us today.
Thank you for having me. I appreciate it.
Yes, Dr. Zechowy. I remember when you called me. I still remember when we were on the phone, and I don't know exactly how you found me, but it just seemed heaven sent, that because you're just like this missing piece that we really needed some knowledge about. So I think it's just fantastic that you come on the show today and actually to drop some knowledge about your field of interest and research. I wondered if you could start by just telling us a little bit about what inspired you to focus on this particular issue of perinatal mental health issues.
I think it's just such a critical juncture of time in which you can have a huge impact on both the woman, the baby, the family, getting off to a great start for the whole family, for the whole being. And I practiced as a family physician for about 10 years before I changed into women's mental health. And I saw so often that many problems were lifestyle based, many illness and disease. And so I really wanted to work on what's that most critical time you can have a big impact and help set this baby up on a great trajectory and have a mom enjoy motherhood, enjoy her baby, be really bonded, and be this protected, healthy unit together.
Fantastic. So giving birth is a time of enormous hormonal shifts, and followed by this prolonged period of minimal sleep, really exhaustion, and a whole set of new stressors that were not previously part of the family's daily routine. There's in-laws and parents and lots of crying and breastfeeding issues and pain, dealing with pain from the birth trauma, and even emotional trauma from the birth experience, sometimes surgical incisions, just to name a few of the factors. And some women really find themselves struggling with a wide range of emotions. So let's start with the basics. When we're talking about, I know Jean was talking about postpartum depression, but I think you were talking about perinatal. I think we're talking about perinatal mental health issues, referring to the time around the birth of the baby.
Correct.
So are we now calling postpartum depression really, should it be referred to as perinatal depression?
So most people know it as postpartum depression. That there's been this growing awareness about it. And luckily, there's been this growing awareness where people are beginning to identify what they're dealing with. But what the research is showing and has shown for some time is actually 40% of postpartum depression actually begins during pregnancy. And so perinatal, meaning around the time of birth, as you said, is a more appropriate term. And amongst people in the field, we call it perinatal depression. But I will often use the term postpartum depression, or I shorten it to PPD. But the most technically accurate term, and the term used by clinicians and researchers, is perinatal depression, correct? Yeah.
Is there also some perinatal anxiety that comes into play with that? Is it really just depression? Is there depression and anxiety? And do we know what causes these perinatal mood and anxiety disorders? If there are, I remember people being very anxious, but I'm not sure it really goes into this, what you would call perinatal depression.
Anxiety and depression often go together, but some people just have postpartum anxiety. And in fact, there is a lot more findings that some people may have just postpartum OCD, postpartum PTSD. I think that postpartum anxiety is an area where we're going to see a lot more focus now that there's more growing awareness of perinatal depression. We'll see a lot more focus on the anxiety part of that as well. And that is also very common.
I was wondering if there are any warning signs for women as they go along their pregnancy. Absolutely, that resonated with me when you talked about OCD and also, just some anxiety, because women are always worried about doing everything right. They're worried about doing everything right to get pregnant. They're worried about doing everything right during their pregnancy, and then it really comes down afterwards to whether they're doing everything right with this newborn. And I was just wondering if there are any warning signs that women could be sort of clued into that it could be something kind of more serious looming for them.
You bring up a really good point that we're so aware now of how to parent more properly, more foster, and we don't spank our children, and we don't do a lot of things that just people didn't really think about very much. We're very conscious in parenting. And so it is making people very afraid they might not do the right thing. And we're getting so perfectionist in it that it is a breeding ground right now for anxiety, because so afraid of doing the wrong thing. And you hear the joke, I'll put another nickel in the therapy jar for the child later. Each time a mom feels like or a dad might feel like they didn't have the best response. So being pretty hard on ourselves. And so, these are areas that we need to just be a little more welcoming and kind to ourselves on. And then there was a second part to your question, and if you could repeat that.
Yes, of course. Are there warning signs that women should be aware of during their pregnancy? Certainly, if you know that you have OCD or you have an underlying, depression or anxiety disorder, that doctors are very concerned about that. But are there any other warning signs for women who do not have a diagnosis?
So feeling down, noticing your energy is worse and worse, which it's very tricky because in pregnancy you can feel so fatigued. It's quite normal. You're growing a baby. Your body's resources are being sapped to grow that baby. But if you notice that you aren't able to find joy in things that you used to find joy in, if you find you're very irritable, and women are sometimes having rage, perinatal rage, things feel hopeless, you're feeling a lot like, I'm going to be a failure as a mother. Those are all signs that are concerning, and you might want to talk with someone. It's much better to go in early and prevent problems from getting bad than waiting till you're feeling terrible. It's harder, and anybody can be treated. But the earlier you begin talking with a therapist, certainly the better. You can prevent kind of going down and having a really bad experience. And women who have had really rough childhoods themselves or never felt particularly close with their own mother, these are times that, there's some stuff there to look through so that you can have a completely different experience with your own babies.
Right. And this would also be a time when issues with the relationship or issues with the in-laws starts to come up. And I don't know if everybody knows this, but what's it called? Spousal violence increases dramatically during pregnancy. Which is very, very, very tragic. I actually lost a patient to a suicide while she was pregnant because of abuse, spousal abuse. So doctors really have to be aware of this, and women do too, and know where they can go if they don't feel safe at home.
Absolutely. If a woman isn't feeling safe at home, they should seek help and support. There's national hotlines. And if a woman is having thoughts of hurting herself, ending her life, or feeling like somebody else would be a better mother to them than they themselves, those are signs of postpartum depression. It really sneaks in and hijacks your thinking. so that hope almost feels like it just can disappear and fade away. And the darkness feels so real and authentic. So it can be sometimes very tricky to realize it's depression.
Why do you think it's difficult for women to admit to being depressed or anxious during pregnancy or postpartum?
One is the stigma. It feels like a mark of being a bad mother, but it certainly isn't. In fact, perfectionism is one of the risk factors for developing postpartum depression. And the moms I see take fabulous care of their babies. The moms are miserable. And the other thing I was alluding to before, though, is that depression, it just sneaks in. It's very insidious, and it takes away your hope, and gradually things just feel grayer and grayer. And people will say, I'm not depressed, I just feel like life is miserable, or I'm not depressed, I'm just not a very good mother, I'm not good at this. And it just makes people very hard on themselves, and they only see the negative. So I think depression itself can be the biggest barrier to seeking care. Nowadays, there's lots of famous women coming out and saying they've had postpartum depression. I think that's making a huge difference. Each time someone steps forward that we look up to, or we see how successful they are as people, and to hear of their struggles with postpartum depression or perinatal depression, it really makes it easier for other women to go, oh, maybe that is what's going on with me.
Right, I agree, absolutely.
We've got so many things going on.
Mm-hmm.
Like right after birth, and I remember this like vividly. I mean, first of all, you're exhausted. I mean, like flat out exhausted.
Yeah.
And you've got all these hormones just washing through you, changing so much. And I think this is one of the things we work on in the Pregnancy Advantage, is to help women to get their bodies ready, cleaned out, so that we get the toxins out. So if you're dealing with diet on top of, like if you're still eating the SAD diet, you're going to have those health issues on top of all these changing hormonal things. So I just remember it was so overwhelming. I mean, and just sleep. I mean, oh my God, you're being woken up every couple of hours to feed me, and you're just like, oh my God. And it's like, am I ever going to get my life back? I mean, like, seriously, I mean, and it's such a big, I mean, it's wonderful. Don't get me wrong. I mean, producing another human being is just like, it's an amazing miracle. But wow, what a toll it takes on you. And so how is like postpartum depression different from like baby blues? We've heard about the baby blues. How is it different?
So baby blues affects about 80% of women at less than 2-week period, like the first week or two after birth. They notice themselves feeling very emotional, tearful, overwhelmed. And as you said, there's a lot of reasons to feel that way. But when it goes beyond 2 weeks, or if it's severe, affecting your ability to function, then it's not postpartum blues. Then we begin thinking, could this be postpartum depression? And that's when it's time to look into going the next step for treatment.
So are there any effective therapies like that you can do for the more common like baby blues?
Healthy nutrition, getting all the help you can get so that you have a plan before the baby is born, to have people in that you trust, that you feel safe with, that can take care of the baby so you can nap during the day. Just having people that you can contact so you don't feel alone, having other friends who have had babies, who are pregnant, that you can talk to combat the loneliness, getting outside for a little bit every day, getting that morning sunshine or some exercise that you might feel up to, kind of just walking, kind of pretty gentle stuff, or cat and cow pose, if you are familiar with yoga. So really nurturing yourself during those moments, allowing yourself to feel the feelings, not necessarily diagnosing them, but taking in the moment. It's a pretty amazing period of time. And so feeling your emotions go from elation to complete sadness several times in one day, it happens, it's normal, it's natural. But if it doesn't fade away, then it's time to begin talking with someone.
What should women do if they think they have perinatal depression or anxiety?
Mm-hmm.
How quickly are we talking? Should they act and actively seek professional help?
So if a woman is thinking of hurting themselves, has hearing voices that aren't there or seeing things that aren't there, those are times that right then and there that day you have to seek treatment, and you don't want to be left alone with your baby. Beyond that, if you've noticed it's been a few weeks, your mood is down, you're not liking how this is going, you're not feeling good about yourself, then you can call your prenatal care provider, your pediatrician. They should have lists of names of people in the area that they trust, that you can see. In this time of telemedicine, you can see someone within your state. They don't even have to be that close to you. And then there's organizations like Postpartum Support International, PSI.net, that provide lists of different people with a focus in perinatal mental health. So you can look and see who is on that list. And those are all people trained in perinatal mental health.
I was wondering, since we talked about that, so many women experience baby blues, and it goes on for about 2 weeks, and then they often come out of it. But then there's another subset of people, and maybe it isn't a subset. That's what I was wondering, if that actually develop a more severe depression that actually needs to be treated with medication. Is there a physiologic basis for this? I mean, we were talking about some of the sociological factors involved, but the pressures and the sleeplessness and all of that. But I'm just wondering if there's and we mentioned something about hormonal shifts, but what have you learned about just the physiologic basis of peripartum anxiety and depression?
We don't know. Like, there does seem to be a genetic marker in some cases. We used to think it was all hormonal and hormonal shifting, but we no longer think that is as big a piece as we used to, because if you look at the data, so 1 in 8 women will have depression or perinatal depression with a pregnancy, yet 1 in 10 dads have perinatal depression, and 1 in 10 adoptive moms have perinatal depression. So it's not all the hormones. There is definitely some piece that is the hormones, but there's definitely other factors going in to what causes it. And we don't fully understand it. There's certainly a genetic component. So if your mom had postpartum depression, seems like you're at higher risk. Still, the odds are that you will not get it. I don't want to terrify everybody. 1 in 8 means 7 in 8 do not get depression with each pregnancy. So it's something to be aware of. But then I think there's a lot of different factors. I see if women have breastfeeding difficulties, they're more likely to have perinatal depression. If they have twins or multiples, if they have a lack of support, I think loneliness is a big factor. And returning to work, if your maternity leave is less than 12 weeks, the shorter it gets, the higher the risk factor for perinatal depression. And then there's about 15 other risk factors as well, and intimate partner to violence, as you mentioned before. And then having a very rough or difficult childhood or not feeling loved yourself. When you then have a baby, these fears happen. Will my baby feel and suffer like I did? And so that can be very scary and be terrifying to a mom who loves her baby and wants to protect them from everything they endured. So many women are very successful with wonderful careers now, and they often know that the moment they return to work, they're going to be in the office 70 hours a week, sorry. It may feel like 70 hours a day. Or they're going to be flying off to China 2 weeks after returning to work. And so sometimes there's preemptive grieving in which they are recognizing they're not going to get to see their baby as much as they had wanted. And so they sometimes will protect themselves from loving the baby too much. And this dilemma causes great pain to women. And so a lot of the work that we do is finding ways to maintain connection and where to set limits on work and how to navigate that difficult dilemma.
Thank you. We do have a question on deck from Barty. So thank you for joining us today. She says, I have thyroid and cannot conceive from 18 months. So I'm assuming that she's got thyroid issues and has a difficulty conceiving. So just one thing, I just want to share with you that I was able to heal my thyroid because I was told straight up from my doctor. She looked at me straight in the eye and said, you'll never heal your thyroid. I've never seen it happen until now. But, changing to a whole food plant-based diet, we've seen so many people being able to change their thyroid and heal it. So a lot of these things, when you go talk about it, the thyroid is, part of the endocrine system. So that's a huge part of what you're dealing with, and you're trying to conceive, and your ovaries are part of that endocrine system. So if you're consuming foods that are high in endocrine disruptors or chemicals, like, for example, your personal care products, the body lotions that you're putting on, a lot of those things can be endocrine disruptors and can cause you to not conceive. But Deborah, I'm going to let you jump in on that question a little bit more.
Well, I appreciate the question, but I really would like to get back also to talking about perinatal depression, since that's the topic of the day. But you could reach out to us, and certainly you could read Dr. Neil Barnard's book, Our Body in Balance. And I think your story about healing your thyroid is important. If you can't actually reverse the condition, then you can take medication to make sure that you are euthyroid, meaning that your thyroid function is, even by taking some extra, is normalized before you conceive. It will certainly help you to conceive. But making sure that you have enough iodine in your diet, because that's something that we're often very deficient in, is also important. So these are things that we talk about in the Pregnancy Advantage, and hopefully we can be of some help. In my experience as an OBGYN, I had many patients. I had patients of many different ethnicities, and women who were not even first generation, but they had come from India and Pakistan, who had babies here, routinely, always had their mothers come for about 3 months, and then their mother-in-laws come for about 3 months. I mean, they had somebody with them, a mother or mother-in-law, for the full 6 months. It was without fail. And I never saw any of these women have any issues. And so I think you had brought up this idea of support. And I just think it was interesting. I don't know whether I didn't do a study. It was just what I experienced in my practice. But I wondered if that's something that you would come across, if there's any data about that.
Not about that particular population, but I definitely see that certain traditions can be so protective or others can be harmful. The tradition that is common in Mexico is to have 30 days where the mom stays home and the family members come and they take care of her, and it's a loving, wonderful, supportive experience, very much like that. But however, when women come to this country and don't have their family nearby, the 30 days of being at home can be very lonely. And so then I see it sometimes as a setup for depression if she feels she can't go out, if no one's visiting her, which is difficult to get that kind of connection these days.
You know, with some of our population from China, they actually have sort of set up these freestanding postpartum maternal centers where women would go and spend the first 6 weeks being cared for.
How
with
wonderful.
other women. Yes, it's incredible. We've had patients who've gone there. So again, just really a setup for lots of support. And I think that really does help, although I don't know if there have been any real studies about that. But what you're mentioning is when you expected the kind of support, and there have been generations of people having this support, and then it's not there for you, that would be like someone just pulling the rug out from under you. It'd be worse than, right? You know, I was in my practice in the past, when women had a history of postpartum depression, we would be proactive with the future pregnancies, and we would start them on medication. If they needed medication in the past, we would start them on that medication at 36 weeks. Is that something that you still recommend to try to stave off the depression?
In some cases, absolutely. Because I'm trained in therapy as well as prescribing meds, a lot of times we just begin the therapy. If I have a client who had a postpartum depression, I say, okay, when your next pregnancy, come on in pregnancy so we can monitor. And then if we see things beginning to go down, then we'll act and do medications. But oftentimes with lifestyle and nutrition and addressing the areas in their thinking, the negative self-talk that might be inviting that depression in and unintentionally, we can often just prevent it and not need the medication. But certainly, I know a lot of women don't want to take medication in pregnancy, but there are a lot of risks to having untreated postpartum depression and perinatal depression. It has a profound effect. So I don't see that as an option generally. People need to be doing something to help get themselves out of the depression.
Things like gestational diabetes. If you have gestational diabetes, you're more likely to develop diabetes later in life. If you have preeclampsia, you're more likely to have a problem with hypertension later in life. I was just wondering if there's any relationship between having postpartum depression and developing a depressive disorder later in life.
Yes, they are tied. And people who have had depression prior to pregnancy are at a little increased risk of having a postpartum depression.
When is your book due out, and how can people connect with you? And are you doing Zoom therapy, and can people be referred to you?
Yes, I'm doing telemedicine. Book is being edited, and I'm hoping to have it out this summer is my goal. And then you can reach me through my website, womensmentalhealthmd.com.
Fantastic. This has been really wonderful.
It has been, and we hope to have you back. And next week, we have Dr. Christina Miller to continue our previous conversation, because wow, we had so many questions for her. So we'll be back with Dr. Christina Miller. So thank you, Dr. Jill. We appreciate your time and hope to have you back soon.
I'd enjoy that very much.